One of the operations I'm going to talk about is the gummy smile. What's a gummy smile? The gums are visible a little too much when you laugh. This, of course, spoils the smile. There are a few reasons that leads to this appearance in patients with a gummy smile. They are all different, and the treatments are also very different. For example, the gum was too low. It came closer to the enamel. This should be treated by a dentist. They directly go for the gums. Or the patient's upper jaw is too long. When the upper jaw is too long, the patient lips pull upwards too much when he or she is laughing, and so gums become visible, which is something undesirable. But here's the cause, is the upper jaw being high. How do you detect this? You will have an X-ray. You will have an analysis about the upper jaw, and you will see what's causing the gummy smile. If the upper jaw bone is high, that is the issue, that is the cause of a gummy smile. The thing that needs to be done here is orthopedic surgery. The shortening of the upper jaw. A unit of the bone is taken from the upper jaw and the upper jaw is shortened. This will fix the situation. Now there is an operation I'm performing. This operation called Rubinstein. It is a different kind of surgery. As far as I know, there are two sources on the internet if you do a search. In one, there is a PDF file. It shows and explains the surgery very well. There are even photos. My website is coming out as well. Surgeon friends of mine also ask me, brother, where did you learn this surgery? Now, there's an operation I'm performing. This operation is called Rubinstein. It's a kind of a surgery. As far as I know, there are two sources on the internet if you do a search. Now, in order to perform this surgery, the patient's gums must not recede too much. If that's the case, the treatment is in dentistry, or there shouldn't be too much height in the upper jaw. If the patient has a long face syndrome, if his upper jaw is high, Rubinstein will not give you a good result. Let me tell you a memory of mine. One day a lady came into the clinic. As soon as she came, I realized the situation. Long face, in other words, the patient's upper face is high. The upper jaw is high. She has such length in her face. There is no need to do an X-ray. You can understand it immediately when you see it. This lady came to me and said, in America, I had this operation that you mentioned. They did it, but it did not work. She laughs, and when she laughs, her gums are so visible. It couldn't work because it's quite obvious. The patient has a long face syndrome. Her upper jaw is high. What should be done to this patient is a bone surgery, an orthopedic surgery. A unit needs to be removed from the upper jaw bone and the upper jaw needs to be shortened. So I explained it like that and sent the patient away. Because I don't perform orthopedic surgery. As I said, this operation should be done in women, in patients whose upper jaw bone is not so high and whose lips move up a lot when they laugh. Because if the lip moves up too much, then the gums will become visible. What we do in this surgery is to remove the distance within which the lips moves. We remove part of the upper gum towards the lip. So what we do is actually place the lip to a lower position, below the area where it moves too much. We suture it there from inside. What happens now? There's no more room for the lip to move up. We completely cancel out the stretch that is moving upwards. You will get results at the end of this operation. Because when the patient is laughing, the lip cannot keep going up. There is no place to go. It has been bordered and stitched from the inside. It remains as a normal distance and no longer shows the gum. This operation is explained in the books. It's very easy to understand the logic behind it. In the beginning, it is said even surgeons perform it without knowing or understanding the actual impact it will have. In fact, it is true. In our cases, as we got more and more results, we saw that in the surgery, as we remove that distance, there's no place where the lip goes up and it stays there. The lip cannot move upwards anymore. After you have done a case or two, you understand exactly what you are doing. It is interesting that the people describing this operation wrote this in these books. It is difficult to understand the logic. It's written that the surgeon will be more and more in control when he keeps performing it. Actually, it's very simple operation. How long does the operation take? About not more than 20 minutes. With narcosis and all, it takes a patient about an hour to enter and leave the operation room. As I said, if you research Rubinstein, there's a PDF file on the internet. If you find that PDF file, there's an information about the surgery. There's also a picture about how the operation is done. You'll understand it very well. You will visualize everything clearly. If there's no additional problem in gums or no structural abnormality in the upper facial bone in the jaw part, then this surgery works for most patients.
Yüz kemiğinde çene kısmında bir yapısı anormallik yoksa.
What else I can say?
Şöyle bir web siteme bakayım.
Botox also supports the impact of this surgery.
Botoks da sağlar.
We apply Botox to certain areas of the upper lip, but
Botoks yapıyoruz.
but I don't actually prefer doing it. Because, okay, you block the upper lip from moving up, but it can also interfere with lips and natural movement. So that's not something that I normally perform. I recommend surgery for the patients. I don't have much more to say about it. It's not very detailed surgery anyway. If you want to ask questions about these topics, I have all the contact information on my website. At the end of this video, you will see my email address and the numbers you can reach me on WhatsApp. So you can ask questions there. If your question is about something visual, you please send me a photo.
Problemli olan yerin fotoğrafını gönderin bana.
So if I can see, I can provide better answer. And be patient. I'm getting so many messages. I try to respond all of them one by one. Sometimes it takes me a week to answer them. So I kindly ask you to be patient.